All right, I have 10 o'clock, so I guess we're going to go ahead and get started. I'm going to go ahead and call the meeting to order, and we'll start with the Pledge of Allegiance, please. All right, if we just have everybody please turn your cell phones to the vibrate, silence, or off setting. The Opioid Abatement Funding Advisory Board allows any person to speak regarding an item on the agenda. The speaker is limited to 2 minutes unless otherwise determined by the chairperson to allow sufficient time for all speakers. Speakers shall refrain from abusive, profane remarks, disruptive, outward protest, or other conduct which interferes with the orderly conduct of the meeting. Upon completion of the public comment period, discussion is limited to the board members and questions raised by the board. Do we have any speakers signed up?
No, ma'am, we have no speakers signed up.
Okay, thank you. All right, first item that we have on the agenda is, has everybody had an opportunity to review the minutes from the previous meeting from March 31st? Do I have a motion to accept the minutes?
Motion made.
Do I have
Second.
all approved?
Aye.
Aye. Opposed, same sign. So next, we have the opioid budget review.
All right, so it looks like we got our last funding allocation in January 28th, 2025, so we won't get another one of those until the beginning of 2026. Our current balance for this year to be able to award is $1,670,054.89.
Does anyone have any questions? Okay. The reporting on community notice of funding availability awardees.
So we're going to start with the Escambia County EMS core team.
Hello.
Hi.
So we have been very busy this year, extremely in fact. Currently, we have had a total of 447 patients since we began into the program. We have successfully transitioned 384 of those patients. We, in looking at the number, have had only 16 relapses who have then returned to the program, which is considered a huge win by the state. This year, we have already had 1,450 dosing appointments. Those are patient contacts. That already surpasses our entire year total from 2024. So it's been a very, very positive, very, very good year to be able to help a lot of folks. We did notice a huge uptick at the start of the summer, and we have remained steady. We currently have 8 going. Last week, we were up to 19. So a lot of times, while we get a lot of folks from the EMS field, word of mouth from patients to patients has been huge, which for us means that we do what we say we're going to do. And that's the most important thing for these people. We have their trust.
Absolutely. That's awesome numbers, only 16 that you've
Yeah.
had to have back. That's great. Great percentages, great work. Does anybody have any questions?
Just a quick question. Excuse me. Are you seeing any particular patterns or shifts in terms of who you're serving or a drug of choice or that sort of thing?
It's not that there's a particular pattern. We do notice that there's a lot of polysubstance, a lot of meth that was tainted with fentanyl is how a lot of folks have somehow become addicted to fentanyl. That is one thing we have noticed. We've also seen not as much of the unhoused population, and we've also started seeing a few more pregnant females as well.
I do have one other question. Do you provide the substance abuse treatment part of that, or just med management, or is it still a combination of both of those?
We do a combination.
Okay,
In light social work, but we're not really social workers, but we do know who to connect, like our pregnant females, with the services that they're going to need, who to contact at DCF before they deliver, to ensure that they don't have problems afterwards, because the goal is to make sure that mom and baby get to stay together.
great, thank you.
Thank you.
Next, we have,
Go-
oh, go ahead.
Next, we have Community Health Northwest Florida.
Good morning.
Good morning.
Thank you, Board. Community Health Northwest Florida. So our numbers, to date, we've got 256 current and active patients in the core program. If you reference that 276 number from EMS that came to us, that shows about a 92.7% retention rate. So we're doing pretty good on that. What we've really focused in on is when people start dropping off, or they miss a couple of appointments, reaching back out to them and trying to really re-engage. We've got a tool, so if we've got a bad phone number or don't necessarily know where they're at, we can find their new cell phone number and try to locate them, and we've been really successful with that. And that's just a testament to our clinical staff and building that relationship kind of judgment-free. We've got 165 current patients with diagnosed opiate use disorder on MAT. So that's a pretty significant number. Again, we've been in operation for close to 3 years now, coming up on 3 years. So building that empanelment out. And then I know this isn't Escambia County, but we've got the contract in place for Santa Rosa Core. And so we're really excited because that's going to be kind of a region-wide addressing of the issues, because we do factually have people who have since moved to Santa Rosa County since engaging in core, but are having to come back over to Escambia for services. We recently got one of our internal staff fully licensed as a peer support specialist. She also, her name's Tracy Peterson. She also does all of our Affordable Care Act CHIP Medicaid. So having her as both a peer support specialist as well as somebody who understands insurance and can really case manage and support is really beneficial, especially with a lot of the changes that are happening right now with insurance. So, any questions?
I'm glad to see that you're moving to Santa Rosa County, because actually I have a participant in another program that is going through the core program as well. So that's great. It'll be a great.
So, and we'll be actually setting up a clinic at our Caroline Street location there. So we actually just posted a few jobs. So if you know anybody who's looking for a job that's licensed or in that space, Northwest Florida Health's been great enough. They're going to give us 6 months to ramp up so that we can really train, shadow with EMS, and really hit the ground running with that team.
That's
So,
awesome. Thank you.
Thank you.
All right, next we have Ministry Village at Olive.
Good morning, Drayton Smith with Ministry Village. As our report does not change much in recent time, we're still dealing with building issues, civil engineering, and those kind of things that everyone else is dealing with. With that happening, the cost has gone up as well. So we're still working with that, and it's just a slow process. I'm kind of a microwave person, not a crock pot person, so it's tough for me to sit on these waiting events. Currently with CARES House, we are at full capacity. We do have a waiting list of about 10 ladies right now current. So we've had contact this year alone with over 190 that have either been declined or waiting on coming in. So this addition will be greatly used, and we need it soon. We do have a new bid out for more buildings since the cost has gone up. So still just dealing with those issues. Currently, like I say, we have a full capacity, and we are looking at our numbers up to this point. We have a 80% after 7 years success rate, so that means ladies are sober up to 7 years. That's as far as we can track right at the moment. So 7 years, 80% of our ladies that graduate our program are staying sober, and we have over a 90% reunification with family and children. Any questions?
How far along are you, what's your added cost for building?
It's going to be about 25%. Cost of metal, cost of copper, all of those type of things. Cost of labor.
Since we talked last, huh?
I'm sorry?
Since we talked last, huh?
Yes,
Wow,
yeah.
wow. So what does that make your total cost now?
We'll be well over $1 million.
Okay, okay. And so you guys, you're in like funding search now, or like? are you
Yes,
guys gonna- are
we
you gonna phase
currently
it
are
in?
seeking other grant opportunities as well as individual donors and companies and things of that nature.
So with the funding that you have, how many buildings are you looking at putting up?
This will be one building to house up to 30 more ladies.
Okay, it's only one, okay. I was thinking like it was like two.
Yes, for our property total, we have 3 projects going on right now for Caris House. It will only be one building. We do have our Tender Hearts Caring Hands property that will expand our homeless and indigent care, underserved, unhoused community. Totally 2 separate things, though.
Okay, so with the funding that you do have, is it possible to move those other projects along, or are you just trying to, you just holding this funding for that one building?
This funding is strictly for the Caris House.
Okay,
Yes, sir.
all right, roger that.
Thank you.
One more question, Drayton. Are you still considering looking for an existing building to rehab?
Not at this point. We did, we actually had a pretty good deal on a house that was a very large house in the Molino area, but just the regular upkeep for that facility, it was 30 acres, a 15,000 square foot house that we could move 20 ladies in there immediately, just put beds in it. But logistics and then some other reasons for just a regular maintenance on that facility and then getting our ladies back and forth for jobs and appointments, we decided not to go that route. So I think since we spoke last, the property that we had already allocated for this project had some old buildings on it. Those buildings have been removed, and again, we're just waiting on civil engineering. We have our tentative plan for civil engineering, and it's at permitting now to come back to civil. So no, we're not looking at another facility. I mean, unless there's one that's ready, available, and we can move into, which is the same issue that Waterfront's having as well, so, yeah.
Thank you.
Thank you.
All right, next we have Waterfront Mission.
How are y'all doing? Mark Isbell with Waterfront Mission. I just want to give y'all a couple of numbers real quick. We actually have not released these publicly yet, but we will be doing that this week. As far as Waterfront as a whole, our numbers have increased significantly the first half of this year over last year. In fact, number of nights of shelter and meals served has increased 34% overall over the first 6 months of last year. In fact, we have, through the end of June, provided over 43,000 nights of shelter and served over 106,000 meals at Waterfront. And part of that is due to us opening up women's services and women's shelter overnight. We've provided over 6,000 nights of shelter just to women alone the first half of this year. But specifically in regards to our recovery program, in May, we had our largest graduating class of our recovery program. We actually had 10 gentlemen graduate, and we have a graduation every quarter. Right now, we have 43 individuals that are in our 9-month-long recovery program. And so that goes towards the increase that we need for housing. We are still shopping. In fact, we last month got outbid on a house, unfortunately, that we had looked at. We looked at 3 additional last week, one that we are very interested in. So our search is still going forward to be able to house the increase that we're seeing at Waterfront. So that's, any questions?
Yeah, just for clarification, so you're looking for individual houses to be part of the program that you have?
Yes, sir. So the third phase of our recovery program is where they will live in transitional houses. Right now, we currently own 4, and we're looking at purchasing another one that we can house 8 additional men in that house. So this is the very last portion of our recovery program before they graduate and transition out. Any other questions?
No, thank you.
Thank you so much.
All right, next we have Lakeview Center CAT program, CAT/AIM.
Good morning, Patty Hyde for the CAT/AIM program. We are up and running. I'd like to introduce Tricia Morrison as our therapist. An interesting composition of Lakeview is not only do we help our clients grow, but we help providers in the community grow. So Tricia started out on MRT and came to me as an MSW intern last year and has graduated, and now she's returned to our program and is on her clinical license for social work. I just wanted to point that out. We work at different levels. We have a BTEC in hire process. We have had barriers to hire an RN/case manager, so we have requested to you to replace that with just a case manager. Sometimes it's easier to find that position, hiring position. We have a group starting next Monday night with we've got 7 people on the list right now. We had 9 and we're down to 7 so far. So we've also been networking and sending out our flyers and our brochures across the county. Those groups will not only have substance abuse education, but they will have skill building for employability for our older kids, as well as care coordination back to school in some form, if it's the GED. So we do a lot of that in our groups every week, and we also work on family conflict. We are also in the reapplication program for next year. Do you have any questions?
Yes, the age group that is this your first group that you all are, since you kind of gotten started, your first group that you're moving through right now?
Yes, sir. We just finished hiring, at least for Tricia.
Okay, awesome. That's great. That's great to know. So your age group of this particular groups is from what to what?
For the program itself, it's from 5 to 18, and the purpose of that is to be able to help families where substance abuse in that home has impacted a child's ability to function across systems like school. We won't have 5-year-olds in that group, so in my experience and in the past, that group has consisted from the age of about 13 to 18. It's more the older youth.
Okay, and so these youth would have, they would actually have experience with substance abuse, or would they be experiencing situations from the parental substance abuse?
All of it.
All of the above?
Yes, sir.
And how do they, like if a child or a person, how do they become part of your program? Is it court ordered, or they have, it have to be through a legal situation, or, or if someone have a child, could they just come to you all and say, hey, my child is going through this, they need help, or do they have to actually go through the legal system in order to get referred through the legal system?
We take referrals across networks. They don't have to be in the legal system. The group that we have coming now is through DJJ for the most part. They're referred sometimes by their JPO, sometimes by the judge for substance abuse education. We take referrals from individuals, from family members, may have heard about the CAT team working with somebody in their sphere and are reaching out either to them or to us directly. The CAT teams, we work with their clients as well. That's the CAT and the AIM. We take school referrals. We take referrals. Basically, we're looking for the criteria would be any kind of interaction with the acute stabilization unit. So if they've had any Baker Acts that may have been either from an overdose or getting caught up with the wrong people at the wrong time. schools, the counselors may notice somebody really struggling, especially some of the younger kids, really struggling in class and kind of read it back to the family issues. So we're not structured to just take one type of referral.
Awesome. And now that you got your staff together and you've gotten your hiring, so do you guys meet with these clients weekly, daily, monthly? How does that work? How do you?
They will have at least one group weekly, and then we'll have the case manager do care coordination with them around school and employability, so they'll meet with them an additional time a week. And then if they're working on conflict resolution skills with their parents, the BTAC will go into the home and role play some of those skills. And so those skills will be based on their initial support plan. When they come in, we get a support plan around what conflict looks like, what got them into trouble, and start just on day one, start teaching some of those de-escalation techniques, especially to parents, on how to walk away and don't engage.
Awesome. And last question, at your staffing capacity right now, how many kids are you actually capable of taking on right now?
Right now, we're at our limit with just one person. We're looking for at least 15 each 90 days. That's usually a good portion for a group. Any bigger than that, and it's not real effective. As well as the individual needs that they may have for their care coordination. Tricia is so experienced that she can handle all of those different areas. So mainly right now, we will be focusing on the groups.
Okay.
Until
Well, I
we
can
get some
see
more
your
hires.
program, I can see the desire for people, for your program now that it's activated and you've got staff. I can see that the need is going to explode, like once the word, that the words gets out and people know that there's something, because for a long time, the adolescent situation or the under 18 situation, has not been in existence for a while in a major capacity. So I can definitely see that your phone is going to start, getting really active. So God bless. Congratulations to you all.
Thank you so much. We do hope to expand in the next couple of years. We're doing, again, the reapplication process right now, which will refine a few things, and then perhaps the next year. We had a 10-person team 2 years ago, a year and a half ago, and so we really would like to expand to meet more people's needs. Thank you.
Thank you.
All right, and last but not least, Lakeview Center OPIS program.
Good morning. I'm Cindy McLaughlin. I'm the program manager for the OPIS program, and I brought the OPIS team with me today. I have Maria Thompson. She's the program coordinator. Vakara Blackman, she's our environmental strategies coordinator. Kirby McMillan, she's our peer educator, and Dorothy Moore, she's our education specialist. For the second quarter of this year, the team has had 176 contacts. The most requested items that they distribute during outreach have been Narcan, of course, fentanyl test strips, wound management kits, and they have conducted 19 HIV tests, 16 hepatitis C tests, and provided their prevention education, the overdose and infectious diseases education sessions at 3 separate locations, and those are 4 class series, so 12 sessions total. Escambia County Jail and 2 of Lakeview's programs are our largest unit and our SRT unit. The major challenge, I guess, for the program right now is that we're still having some issues with the software program for our harm reduction vending machines. So trying to get the manufacturers for the machine to get us some technical assistance to get that software corrected so that it's distributing properly. That's what we're working on right now. One of our machines actually got vandalized, unfortunately. They will cut cables to get copper out of the wires. So we're also waiting for a technician to come out to replace those cords. But the ladies mostly are distributing things now when they do street outreach sessions in the community. And they have several sites that they see now, and they just added a site, which is Warrenton Village. So kind of spreading our boundaries a little bit. And that's our highlights. Any questions?
No, thank you so much.
Thank you.
All right, the next item on the agenda is to review and approve the revised Lakeview Center CAT scope of work.
And this item, you guys do have something in your backup on the Lakeview letterhead there for this particular thing, and they did mention it a little bit when they were up here, but they've had some difficulty hiring an RN case manager, so they would like to replace that position with just a regular case manager to bring on. This will require a vote. If you guys do approve them to switch out this position, it will return almost $32,000 back to our pool of funding. And we can open it up to any questions. They're here if you have them.
Just one question. So if it's regular, from an RN case manager to a regular case manager, I know the need not to having the RN designation to be a case manager is there. So, would that, would that give challenges in the, well, my question, I guess, is why was the need for an RN case manager in the beginning versus a regular case manager?
We were trying to model it on the CAT model, which does include an RN, and our last substance abuse program for adolescents was modeled on that as well and had an RN. We found it very helpful to provide some of that substance abuse education, not just that, but hygiene and issues around human trafficking as well. For a lot of our girls that we had in that program. We can, part of the care coordination that we do with our case managers would be to coordinate with their primary care physician and get them back into that routine of physicals and dental work. And so the case manager is more critical to that piece. And the other piece that the RN we were hoping would be able to incorporate. We also do outreach to different agencies in the community to come in and do education around vaping, around tobacco, around Narcan. We distribute Narcan, and we don't have to have a nurse to do that. So it really won't make any difference in the services that we offer, for sure. I like having a nurse. I like having that holistic perspective. But again, we will very much still be linking them to their PC and providing transportation for those appointments if needed.
Okay, so it wasn't like for regular RN, how they are able to distribute medicine and stuff like that?
No,
So
sir. No,
med-
sir. We don't
okay.
distribute medicines. We don't hold medicines. We make those appointments for them to schedule those.
Okay, so it's basically more just like for educational person that has, like a little bit more, but okay, sounds
sir.
good.
Thank you.
Thank you.
I move approval of the request.
Second.
All approved?
Aye.
Aye. Opposed, same sign. Motion passes. The next item on the agenda is to review and approve the EMS core stipend as proposed.
And I'm actually going to have the EMS core team come up and talk a little bit about this and why they think they need it.
Good morning, Christopher Stevens, EMS. Within the program, we've identified some issues where we could do a little bit better, one of which is direct oversight and communication up the chain through administration and also through our community partners. So we're going to ask for a lead nurse position. This also lays the foundation for future growth. We've somewhat mirrored this within operations, and it's streamlined our process and become very effective for us. And we believe it's going to do the same for the program here.
So this would be a stipend given to an existing employee for the additional
Yes,
or
sir.
the change in
Yes, sir.
responsibilities?
Yes, sir.
And just for your knowledge, this was run by our HR department, even though it's paid through different funding. And we do have a policy for it too, so it is in line with what we have done with other things before.
Thank you.
I move we approve the request.
Second.
All approve? It's on vote, sorry.
Yes.
Opposed, same sign. The motion is approved. The next item, do we have any new business that needs to be discussed at this time?
Do you guys want a quick update on who attended the pre-application meeting for this NOFO year?
Sure.
So we did hold the Wednesday, July 9th optional pre-application meeting. The community partners that attended that was Brightbridge Ministries, Reentry Alliance Pensacola, Community Health, Waterfront Mission, and Ministry Village at Olive. And then we did have 2 additional community partners reach out for the recording just to see what took place on the meeting, and that was United Way and Hope Above Fear. So last year, I believe we had 1 community partner attend this meeting, so it's definitely getting out there. Lots of new faces that didn't apply last year, which is exactly what we wanted. This also was an optional meeting, so even if they didn't attend, they can still apply. This just kind of gives you an idea of what partners are out there actually looking at this particular funding source this year. So I'm anticipating we get quite a few more applications than we did last year.
After Brightbridge, was it, who else was it?
Brightbridge, Reentry Alliance Pensacola, so REAP,
Okay,
Community Health, Waterfront Mission, and Ministry Village.
Okay.
And then the 2 that reached out were United Way and Hope Above Fear. And I know that Hope Above Fear didn't qualify last year just because they hadn't reached that 2-year mark, but they actually really focus in our schools and our adolescents. So that one will be a good one to look for sure.
great. Thank you for the work on that. Any other items for the new business portion? We need to schedule our next meeting. Do we need to make that for September? Or October?
So just looking at our notice of funding applications, the applications are actually due on September 12th. So if you'd like an update at your next meeting for who actually applied, I would do any time after September 12th.
Okay, thank you. How does everybody look for September the 15th?
I'm good.
Will that work? Yes. Okay, we'll schedule the next meeting for September the 15th. Thank everybody for coming, and the meeting is adjourned.